Magandang hapon po mga katribu and welcome to Kalingang KaTribu. Ngayon hapon po, matanong ko nga kayong lahat, gaano kahalaga ang ating paningin? How valuable is our eyesight? Ito po ang ating mga eksperto. Si Dr. Norman Aquino, siya po ay isang Glaucoma Specialist at President and CEO ng American Eye Center. Kasama din si Dr. Mary Ellen C., Cornea, LASIK and Cataract Specialist. Alam ko marami sa mga ating mga kababayan nagkakaroon ng mga eye problems, lalong-lalo na cataract at minsan glaucoma. Ito po ang ating pag-uusapan ngayon din sa Kalingang KaTribu. Please welcome our special guest, Dr. Norman Aquino and Dr. Ellen C. Hi, Doc. How are you?
Good afternoon. Good afternoon.
Good afternoon,
nice to be
Cory.
here.
Yan. Ito. Mga katribo, mga eksperto sila. Kaya huwag po kayong mag-atubili. You can turn in all your questions right now. Pag-uusapan po natin yan. Hihimayin po natin ang lahat ng ating mga concerns tungkol sa ating paningin. Okay, let's start with Dr. Norman. Dr. Norman, alam natin na yung American Eye has just moved to a new, fabulous, spacious center. Please tell us.
Yes, we have. We have been in our new location at the podium, all right? And we have transferred to what we feel is a much larger space that will allow us to really exercise the expertise that the center has been very proud of. You know, gusto ko lang ibalita sa inyo na mahigit 25 anyos na ang nakakaraan. Nag-umpisa ang American Eye as a refractive center. Yan ang nag-umpisa ng LASIK and refractive corneal surgery dito sa Pilipinas at sa buong Asia.
So you are a pioneer. You are the pioneer.
Yes, we are. So from then, it evolved into what is known as a full-scale eye center, wherein now all the subspecialties of ophthalmology are being able to address by all the different specialists that compose the team of doctors in American Eye. So we are very proud of the fact also that it was the concept of American Eye bringing an eye center out of the hospital and practicing in the mall. And now it has become, the standard that eye centers are being set up outside the hospital, and even surgery is being done outside of the hospital. So again, you were right in describing it as a very pioneering institution in this country.
Yeah. I'm looking forward to your new clinic, Doc, because I was told by Dr. Ellen that it's really a fabulous center. So, ayan, mga katribo, pupunta po ako next week. Pero meron akong ikakwento sa inyo tungkol sa aking tunay na karanasan, kung anong nangyari sa akin sa panahon ng pandemya. And I had to run to American Eye, to Dr. Norman, Dr. Ellen, and they saved my eyesight. Ayan, abangan. Dr. Ellen, let's go to you.
Cory.
LASIK, cornea, and cataract. Those are 3 different procedures, right? Or specialties?
Yes, specialties, yeah. Yes. So, cornea specialists take care of the front of the eye, no? Tinatawag natin siyang yung salamin ng mata, no? So, usually, patients who get scars or yung namumuti, yung front of the eye, that's the cornea, no? So cornea specialists also take care of infections of the eye, no? So like sore eyes, allergic conjunctivitis, no? a lot of the infections, no? So LASIK naman is correcting the grade of the eye using a laser, no? So we have the latest technology in correcting nearsightedness, farsightedness, and astigmatism, no? Using the latest lasers for that, no? And then cataracts naman are the clouding of the natural lens of the eye. So inside our eye, we have a lens that usually, when we reach the age of 40s, it loses its natural ability to focus. So when we reach the age of 40, di ba, usually, most of the patients need reading glasses. No? So that is called presbyopia. And
so
then,
sorry, Dr. Ellen, cutoff ba is 40 years old?
Usually, yes. That's the cutoff for presbyopia. And then, when we reach the age of 60, normally, that's when cataracts start. No, it's like I tell my patients, like white hair. No, so you cannot avoid it. No, it will happen whatever you do. No,
kahit anong tao. I mean, lahat
Yes.
ng tao meron din silang kanya-kanyang level ng cataract deterioration.
Yes.
Oo.
May mga pasyente na mabilis magkaroon ng cataract, no? We notice that in our tropical country, because it's very hot and we're always outdoors without sun protection, we get cataracts earlier compared to Caucasian patients, no? And genetics might also play a bit of a role. But there are also cataracts that develop early. Meron sa babies when they are born. Meron sa mga children or in young adults, no? It's called developmental cataract. Meron naman after trauma. If, for example, you're hit in the eye, after that, you can develop a cataract early. Also in patients who are on steroid medications, like those who are on prednisone for diseases of the like autoimmune diseases, or those who use nasal sprays with steroids, no? They can develop cataracts earlier. And especially,
Natakot nun. Yung mga nasal sprays.
chronic, yes, if you use it there's chronic use, no? You can develop cataracts. And then the most important ngayon na we can probably hopefully prevent is diabetic cataracts, diba? Cataracts in diabetic patients can develop very early, no, because of uncontrolled sugar level.
Kaya pala yung mga taong may diabetes, nasisira ang kanilang paningin. Is that correct?
One of the reasons is cataract. Another is diabetic retinopathy. No, so yun yung ayaw natin is diabetic retinopathy, because the high sugars can destroy the retina or yung film ng ating mata. No, our eyes are like a camera. No, so we have the front, we have the lens, and then we have the film. No, when the film is destroyed by diabetes, sometimes if we catch it early, we can treat it. But in some cases that are very chronic, usually mahirap na siyang gamutin.
Kaya pala may mga ilang diabetics na nabubulag rin.
Yes.
And
Correct.
this one you can prevent, no?
Cory, I would just like to add, no?
Yes, Doc.
Bago misinterpret ng mga tao na ang katarata, delikado. Hindi na ngayon delikado ang katarata. Okay? Kapag tinanggal ang katarata at wala namang ibang naging problema, malaki ang probabilidad na luminaw ng maayos ang mata. At hindi rin naman dapat katakutan ang pag-opera ng katarata ngayon dahil ang state of the art ay yung tinatawag na phacoemulsification, kung saan ating tinutunaw, sinisipsip ang katarata sa pamamagitan ng isang napakaliit na sugat ni hindi na tinatahi ngayon. Alright? So, pag nalagyan ng lens ang loob ng mata, you are good to go. Alright? So, unlike cataract surgery in the past na ikaw ay dadalhin sa operating room sa ospital, hihiwain ang mata mo, tatahiin, maraming gugupitin. Ngayon, it is a bloodless, painless, sutureless, 15-minute outpatient surgery. So, yun lang ang gusto kong matandaan ng tao na huwag niyong ikatakot kapag sinabihang kayo ay may katarata. Una-una, lahat naman ng tao magkakakatarata at some point in their life. Alright? At kapag dumating yung panahon na dapat siyang tanggalin, hindi siya ganun kahirap. Okay? So,
thank you for sharing that. Kasi, syempre yung ating mga katribo nagtatanong din, ano mangyayari sa akin? Makakakita pa ako? Or magkakaroon ba ako ng sugat? Tinatahi ba yan? Things like that, Doc. Syempre.
Yeah, but kapag ikaw magpapa-opera sa mata mo, syempre, kailangan ka rin pumili ng doktor at lugar na pag-ooperahan na medyo maayos. Alright? Sapagkat, if anything goes wrong during the operation as a result of technical problems or competency problems, napakahirap bawiin yung disgrasyang nangyari. So, sa umpisa pa lamang, napaka-importante when you decide to have it done by a doctor who is competent. You have it done in a place that is fully equipped to deal with the situation.
Tama. Ito na mga katribo, totoo po ito. Alam po ninyo, si Dr. Ellen and Dr. Norman, talagang inalagaan nila ako ng napakagaling. I'm so grateful to American Eye dahil po 2-in-1 surgery yun, di ba, Doc?
Correct.
2-in-1?
Correct.
Yung isa ay katarata, tapos yung isa naman po ay glaucoma. Hindi ko alam po mga katribo na meron pala akong glaucoma. Nalaman ko lang nung nagkaroon ako ng parang masakit, matinding sakit at kirot sa mata. I even waited ilang araw, Doc, no? 10 days kasi dahil sa pandemya, everything was on lockdown. So, siguro by the grace of God talaga nakatawag ako kay Dr. J. Arroyo at sabi niya, ano ba hinihintay mo? Pumunta ka na sa American Eye. Alam po ninyo, I'm very grateful sa American Eye Center dahil they saved my eyesight. Sabi nga ni Dr. Norman, kung hindi po ako nakarating sa American Eye, baka hindi na po ako makakakita sa kanang kamay ko po. O, meron ba kayong nakikita dyan? Kumukutin pa rin ang aking mata. So, I'm ever so grateful. Tapos inoperahan po ako ni Dr. Norman, Dr. Ellen, at di Dr. ko. At tatlo ang doktor na talagang nag-alaga sa akin po, mga katribo. And I'm so grateful. Kaya gusto ko salang i-share sa inyong lahat na napakahalaga ang ating eyesight. At kailangan po natin pangalagaan ang ating mga mata. This is the reason why the title of our show is Save Your Sight. Diba? Save Your Sight. How do we begin to save our sight, Dr. Ellen, Dr. Norman?
So I think we have some do's and don'ts for our eye care. No? So I'll start with that. So for our do's, one is eat a balanced diet. No? Usually rich in vitamins and antioxidants or leafy green vegetables, no, to help our eyes. No? Second is wear sunglasses when outside. So we protect our eyes from UV light. No, again, don't stare at the sun. That's very, very bad. Yes. So don't stare at the sun. No. So another is with rising cases of trauma. No, we have to use safety goggles when we're doing carpentry work or some sports. No. We get a lot of trauma cases in our government hospitals, especially even just kids playing with the walis ting or with anything sharp in that they can hold. No? Yeah. So that is very important. It's actually one of the advocacies of the Philippine Cornea Society, no, to educate our patients about wearing safety goggles when doing work. No? Another is all of us are using the computers now in the pandemic. No? So we should follow the 20-20-20 rule. No? So every 20 minutes, look 20 feet away at an object for 20 seconds, no, to prevent eye strain. And then lastly, for the don't, syempre, visit your eye doctor or ophthalmologist regularly. No? So regularly would mean every year. For patients who are 40 and above. Below 40, it can be every 2 years. But for kids that have grades, they also have to see their doctors every year or more often depending on what you have. No? So some of the don'ts, do not rub your eyes. No?
Bawal
So,
yung mga ganun.
yes, a lot of patients ang lakas mag-rub, no? So, rubbing can irritate our eyes and also can cause abnormalities in our cornea, no? So, there is a condition called keratoconus, no? We have a lot of allergic eye rubbers who get the corneas that have problems with their corneas that are difficult na to manage, no? So never rub your eyes, no? Again, don't sleep with your contact lenses on, no? So
Ayan.
we also
Paano
get
naman,
patients.
Doktora Ellen, yung mga taong
Yes.
gumagamit ng colored contact
Yes.
lenses pang fashion, kasi fashionable daw
Yes.
yun.
Yes, we advise you to buy from reputable optical shops or stores. No, don't buy online because online sellers usually sell the inferior quality of contact lenses. And then also don't share contact lenses. We have patients who share contact lenses with each other and can transmit infections through them. No, so infections caused by improper contact lens use and handling, so always wash the hands, can also cause blindness because may mga organismo na pag natamaan ng cornea, pwede tayong mabulag, no? Pwedeng mawala yung paningin. So that's very important also, no? Another don't is do not smoke, no? Smoking is related to
smoking. Ulitin natin
yes.
yung paninigarilyo, bawal.
Yes. So it is has been related to early development of cataract and macular degeneration. So those are my do's and
Yung
don'ts.
mga tao, Doktora Ellen, na hindi sila naninigarilyo but their husband or their wife smokes. Yung exposure sa second-hand smoke, pareho rin yun.
Yes po, yes, no. So we hear of patients who get lung cancer even if they're not smokers, no. So secondhand smoke is also bad, no, for our eyes and for our health.
Cory, dagdag ko lang ha, when you're talking about good practices as far as eye care is concerned. Number one, wag nyo nang intayin na meron kayong nararamdaman sa mata bago kayo magpatingin. Alright? Maraming kondisyon sa mata na hindi mo alam meron ka dahil wala ka namang nararamdaman kaya hindi ka nagpapatingin. Isipinin natin lahat, ang mata ay isa lang organ na kasama ng maraming organ sa buong katawan at lahat sila ay magkakakonekta. Alright? So, kung ang isang tao sabihin na natin may uncontrolled blood pressure problems or uncontrolled sugar, hindi nila alam, pati ang mata nila pwedeng talagang maapektuhan din. Alright? So don't wait until symptoms appear before you have an eye check. A routine, regular eye check with or without any problems in the eye is encouraged para kung meron mang problemang nagtatago, madiskubre na ng maaga. I mean, let me go back to your story. You never knew you had glaucoma until it just gave you sudden symptoms, di ba? And it suddenly became an emergency. Whereas if you had discovered it much, much earlier, you probably didn't have to undergo 2 operations all at once, di ba? So, yun lang.
Kayo ay mga magicians. Mga miracle doctors yan kasi sabi daw nila, yung kaso ko po ay very challenging and difficult ang kaso po ni Cory Quirino, yung medical case po.
Correct.
No? I gave you a hard time ba, you and Dr.
No, absolutely not. No. Part of the difficulties during your time was, as you said, the pandemic. We couldn't move around so much. Our scheduling of surgery had to be very limited because of, having to undergo all these preliminary tests, di ba? But in your case, we had to do it. Otherwise, we would have regretted any delay. No?
Yeah, I'm so ever grateful, Doc, talaga. Alam po ninyo mga katribo, napakahalaga ang ating paningin. I guess hindi natin malalaman yan o mararamdaman ng matinding emosyon kung wala tayong problema. Kaya sabi ni Doc, tamang sinasabi ni Doc, wag na tayong maghintay na magkaroon ng problema. magpa-check up kaagad. Ngayon din ang sasabihin ko sa inyo. Ngayon din. Yan, Doc. So, in my case, let's say yung case ko, ibig sabihin ba yung anak ko baka magkaroon din ng problema? Is that genetic or?
Well, there are some glaucomas that have been found na pwedeng ipamana or nasa pamilya. No? Pero hindi naman porke meron kang sabihin ng isang kamag-anak na meron, sigurado kang magkakaroon. But it increases your risk. And therefore, kung meron kang alam na lolo mo, lola mo, tito mo, tita mo, or parents mo, walang mawawala na regular na magpapacheck just in case namana mo yung kondisyon.
Yes, yes. So, Doc, let's talk about the different eye diseases. Yung para sa kaalaman ng ating mga katribo, what are the different yung pangkaraniwan na akala natin it's just a normal thing, it will go away. Pero nung pala, simptoma na pala yun. Can we discuss it briefly?
Ellen, mauna ka na.
Mauna ako. So I'll go from the front of the eye na lang muna. No? So any eye redness, eye discharge, or eye pain. No? Sometimes patients dismiss it as just sore eyes. Ay, sore eyes lang to, mawawala rin siya. Pero sometimes, hindi mo alam it's a severe infection na pala, or it can be glaucoma. No? Some of our patients are given steroids. No? For example, there's the case of trauma. Kunyari, natamaan ng, you were gardening, no? Our plantitas were gardening, and then a leaf hits the eye. No?
Yes.
Sometimes, when they go to the pharmacy, they are given eye drops with steroids, no? So that is a no-no because the steroids can aggravate any infection that is that has happened on the eye, no? So that is also one of our advocacies because we see a lot of patients who are given steroids when they should not be given that, no? So ang lesson doon is do not go to the pharmacy and tell the pharmacist, ano bang pwede kong ilagay?
Which
diba?
is what happens all the time.
Yes.
A lot of times, yes.
It's a good thing now that they ask for prescriptions. Kasi before, they used to give it left and right, diba? And then, another is, ito yung ginamit ng kapitbahay ko. Okay daw siya. So, gagamitin ko na rin. So, also, please avoid that. And then, and sharing of eye drops, no? So,
ay bawal mag-share ng eye drops, ha? Bawal.
Yes, because you can transmit infections through that, no? So that is one of the most common diseases that we encounter. Another is errors of refraction, no? We can call it a disease, no? Yung kailangan magsalamin, no? Kailangan magsalamin, mag-contact lens, or surgery like LASIK, no? So that is one of the most common diseases that we encounter in our daily practice, no? Another is like I think we were talking about it earlier, the pterygium, no? Pterygium or pugita, no? So if you see somebody with the fleshy mass on the cornea, no?
Parang may balat na tumututok.
Parang may balat na nakaharang. So it usually is common in patients who are exposed to the sun for long periods of time. Like our fishermen, our seamen, those who live near the beach, no? Because the waters actually reflect the sun more, no? So we advise wearing sunglasses pa rin for them.
Doktora Ellen, yung mga nasa beach ngayon, kasi syempre summer.
Yes.
Sila.
We need sun protection. I know tayong mga Pinoy, hindi tayo sanay mag-sunglasses, di ba? But I think we should, no? Especially when going out because our sun here is very, very strong.
So you're saying, Doktora Ellen, yung reflection ng init ng araw o yung sinat ng araw
on the sea,
tubig, mas matindi?
Yes, it's stronger. Yes. That's why a lot of our seamen actually develop pterygium, no? Because of the strong UV light, no?
Ayun.
So, or our fishermen.
Di ba sa mga ibang tindahan, there's like ready-made reading glasses. Okay ba yun? O kailangan talaga magpa-check up at magpa-prescribe ng exact grade?
Reading grade. Actually, if your eyes are normal and the grade for both eyes is the same, the regular reading glasses, sometimes I tell my patients, just buy the over-the-counter ones that like 200, 250, para marami kang pairs. You have one in your office, at one in your bedroom, no?
Yeah.
But if you have a different grade, no, for both eyes, or we have other errors of refraction, then you might really need. Actually, we recommend that you go to the doctor to know if you are that normal person or you need a special pair of glasses, no?
Yun. Okay. Dr. Ellen, I will share with you a condition, yung mga common reaction ng mga kaibigan ko. And I'm always thinking in the back of my head, meron ba silang kondisyon? Ito kumakain kami. Say, nasa restaurant tayo. Kumakain kami, mga kaibigan. Tapos yung isang kaibigan ko, sasabihan ako, hindi ko makita yung pagkain ko. Ano bang kinakain ko? What does that mean? You can't even eat the food.
Yes, so that was what I was saying earlier, that's called presbyopia, no? So if you don't, when you're in your young adult years, if you don't have any grade or any nearsightedness, farsightedness, when you reach the age of 40 and above, the focusing natin for near, because our eyes are like a camera, humihina na siya. No? So hindi mo na, unti-unti, ilalayo mo muna yung binabasa mo. Next is you need bright light, no? Pag hindi na kaya, you really need reading glasses, no? So, those who are nearsighted, a little bit nearsighted when they're in their 40s, it's actually an advantage because they can see things at near even if they don't have glasses. Pero syempre, their distance vision is not that good, no? So in the table nga, my patients tell me sometimes iba-iba sila. Yung iba nakasalamin, iba walang salamin, yung iba, 'di ba? Iba-iba, and you really can tell the age because of that. Usually dati sabi natin, ay alam na natin matanda na siya because she needs reading glasses mo, 'di ba?
Hindi totoo 'yun. Hindi totoo 'yun, no? Okay. So, all right. Yan ang isang simptoma. Yung isa naman, yung paggising sa umaga, sobrang makati ang mata.
Two reasons, possible reasons for that. One is dry eye, no? It's very, very common. So dry eye because of the environment, the humidity. We're always on the computers, on our gadgets. We don't blink as often as we need to, no? So that's dryness because of air conditioning. Another is allergies. We get a lot of allergies because of the pollution, because of dust mites, pets, no? So those are the two things that you think of when patients tell you that their eyes are itching, no?
So kailangan ng eye drops pag makati ang mata?
Yes, I usually first recommend artificial tears, no? So just artificial tear drops, and then they can do cold compress, no? If that relieves the symptoms, then okay na tayo. Pero kung nag-artificial tears ka na at makati pa rin, then you might need a special anti-allergy drops, no? So we have eye drops for allergies that we can prescribe our patients.
Okay. Let's say pag meron yung paningin mo, meron kang nakikitang lumulutang sa harap mo, yung mga iba-ibang objects, black spots or hair, mga ganon.
Yes. That's called floaters, no?
Yeah, floaters.
Floaters. So inside their eye, we have the part called the vitreous, or I call it the jelly of the eye, no? So again, as we age, the jelly becomes more liquid, no? So inside that liquid are the things floating around the floaters, no? Normally, they're benign, but floaters that we have to be wary of are a sudden shower of floaters, parang sobrang daming dots, and with flashes of light. So parang may camera dun sa likod ng mata mo. So when you see that, we advise you to come so we can check the retina and see if there is any problem with the retina, because that can be a sign of a retinal tear no? Pwedeng mabutas ng maliit yung retina natin at pwede siyang mag-cause ng retinal detachment or yung matuklap yung retina natin from the attachment, no? So that is actually an eye emergency.
Okay, pero wag matakot mga katribo. There's always hope. Palaging may pag-asa. Let's go to
Yes.
Dr. Norman. Dr. Norman, nung pumunta ako sa inyo, at talagang kinatatakutan ko kasi sabi nyo, you take these eye drops muna. Oh, good girl ako. Talagang very dutiful. Nilalagay ko yung mga eye drops ko. Tapos matutuloy po ang aking kwento sa aming pagbabalik. Huwag po kayong aalis.
elections na nananawagan po ng pagkakaisa. Ako po si Sara Duterte. Handa po akong magserbisyo sa ating bayan. Hinihingi ko po ang tulong at suporta ninyo para sa pagka-vice presidente ng ating bansa.
Yan po mga katribu, itutuloy po natin aking kwento tungkol sa aking problema. Nagkaroon ng problema noon. So ito yung mga katribu, yun lang i-share ko sana sa inyo. Na yung mga eyesight problems po natin, minsan di natin napapansin yan o minsan binabaliwala po natin yan. Kaya nandito ang ating dalawang eksperto, si Dr. Norman at si Dr. Ellen ng American Eye Center. Yun, yung share ko lang sa inyong lahat na you think it's a small thing. Akala nyo maliit na bagay lang yun, hindi pala. So when I went to see Dr. Norman, sabi niya, sige mag-eye drops ka, titingnan natin kung magbe-behave, magpapakabait ang iyong mata. Ngayon naman, pagdating ko sa kanya, after my 2 weeks yata yun, no, Doc, with eye drops, sabi niyo sa akin, Cory, I have to check if your optical nerve is intact. Di ba? Is intact. Kasi po, pag hindi intact yun, Doc, anong ibig sabihin pag hindi intact ang optical nerve?
Alright. Sinabi ni Dr. Ellen na ang mata parang camera. Okay? Lahat ng kinukuha niyang litrato, ipinadadala sa utak sa pamamagitan ng isang kable na nakakabit doon sa camera. Sa sakit na glaucoma, yung kable na yon ang unti-unting nasisira. Alright? So pag nasira yon, hindi na makakarating yung litratong kinuha ng camera doon sa utak ng tao. Pagkabulag na yon. And that is why people with glaucoma have to be treated and managed well because otherwise, yun ang kakabagsakan, pagkabulag ng mata. At kapag ang isang mata nabulag na, wala na talagang maski sino, maski saan magpunta, wala nang magagawa. So, yung nangyari sa'yo, nahuli natin ang problema, ginawa natin ang paraan para masolusyonan yung problema. Kaya ganyan ka ngayon. Alright? Kasi kung hindi, inaakay ka na siguro ngayon, Miss Cory.
Yun nga, Doc. Doc, kita mo yan, yung puso.
Thank you. Thank you.
Ever grateful sa American Eye. Pero ito pong sharing ko kasi sana makatulong po tayo sa lahat ng ating mga katribo. Ito po ang aking pinaka-panalangin at pangarap na makakasalba po tayo ng eyesight natin. Lahat tayo ng paningin ng ating mga katribo. So please go and have your checkup today. Gusto nyo bang imbitahin ng ating mga katribo na bumisita sa American Eye Center?
Alright. Inaanyayahan ko po ang lahat ng tao na maging conscious sa kalusugan ng kanilang mga mata. Alright? Maraming kondisyon na nasa mata na kung hindi mo hahanapin, hindi mo makikita. Ayoko niyong intayin na too late na bago niyo gawa ng paraan. And how is the best way to do that? Magpatingin sa mata sa isang lugar na kumpleto ng gamit in terms of diagnostic capabilities, in terms of expertise ng mga titingin sa inyong mga mata. Ako po'y magbubuhat ng kaunting bangko. Okay. Sa American Eye, 17 doktor kaming nandoon at bawat doktor na nandoon ay mayroong angking espesyalidad. So, depende sa makikita sa mata ninyo kung ano ang problemang nariyan, nakakasiguro kayo na yung espesyalista dun sa problemang iyon ang titingin sa inyo. Nung dumating si Miss Cory sa amin, nakita namin na ang problema niya ay glaucoma at meron din siyang katarata. Kaya siya ay napunta sa akin bilang isang espesyalista sa glaucoma at kay Dr. Ellen at kay Dr. Ko na mga espesyalista para sa katarata. So, kaming 17 doktor na nandun sa center na yon ay part ng isang buong team. Kami hindi magkakumpetensya, kami nagtutulungan. At sino ba ang makikinabang dun sa pagtutulungan naming lahat? Yung pasyente. So, just like the happy ending that you experienced, Ms. Quirino, it was a result of the teamwork between the different experts and specialists in a center that was fully equipped and ready to deal with any eye condition.
Yes. Alam ko, Doc, maraming salamat, Doc, kasi meron din akong isang kaibigan na pumunta sa American Eye kasi kayo lang ang tumanggap sa kanya sa kaso niya. He has a heart problem. Umiinom siya ng blood thinners araw-araw, pero kailangan ng mag-undergo ng cataract surgery. Lahat ng mga ibang doktor na pinuntahan niya, sinabihan siya na hindi siya pwedeng uminom ng blood thinner kung magpapa-cataract surgery siya. Kayo lang ang tumanggap sa kanya. He is so happy today. Doc, ngayon, bumalik na ang kanyang paningin.
Mm-hmm.
Thank you from my friend. Di ko nababanggit yung pangalan niya. Alam niya kung sino siya. Talaga.
Correct.
Lahat ng mga challenging cases, kaya ng American Eye Center. That is what I have learned. And I was so grateful you took care of me. Dr. Ellen, you asked people to come and visit you for checkup.
Yes. So American Eye Center is now located at the 4th level of the Podium Mall. No, our patients might try to find us pa in our previous locations. No, but we would like to tell everyone that we've moved. No, to a bigger and brighter center. No, so we are open every day from Monday to Sunday. No? So just give us a call, or I think we will flash the numbers later. No, for your appointments, no? So, we hope to see you there.
At definitely, pupunta ako sa American Eye. Magkita-kita po tayo doon sa American Eye Center. Sa darating na linggo, andun na po ako, Dr. Ellen.
Yes, I'll see you next week.
Marami pong salamat sa ating mga special guests today. Eye Care Specialist, si Dr. Norman Aquino and Dr. Ellen C. ng American Eye Center. Mga katribu, I hope you learned something today. Save your eyesight. Kung mahal po natin ang ating sarili, hindi lamang po tayo magpapa-check up sa ating katawan. Pag may executive check-up, di ba, lahat from the top of our head to the bottom of our feet, di ba? Magpapa-check up po tayo. Pero kung talagang mahal po natin ang ating sarili, please take care of your eyesight today. Ngayon din, wag na kayong mag-atubiling pumunta. Magpa-check up ngayon din. Okay, mga katribo, stay safe pa rin and take care. God bless. Hanggang sa susunod ng Kalingang KaTribu, ito po si Cory Quirino.
Boses natin sa Kongreso, PG Party List. Kasangga mo, balot 108 iboto, PG Party List. Basic good. Atin to, pagkaisa ng marig ang mga hinaing. Young and active leaders sa Kongreso, ang boses natin. Tandaan at iboto, balota 108. Civilian realize the projects we dreamed of. PG Party List, vote 108 na. PG Party List, kasangga mo, balot 108 iboto. PG Party List, boses natin sa Kongreso. PG Party List, kasangga mo, balot 108 iboto. PG Party List, basic good. Atin to, PG Party List, atin to.